Welcome to the Legal Networking Forum. I'm Christine Mantyla, Community Outreach and Marketing Development Coordinator with South Coast College. This virtual brings education, local resources, and connections to our community. We value creating business relationships and sharing opportunities. My guest today is Miguel Dominguez. Miguel Angel Dominguez was born April 16th, 1961, Colonial City, Puebla, Mexico. His mother was widowed with 6 children. She migrated to the United States. Raised in inner city Los Angeles, along with beginning elementary school through college and professional school, he was able to appreciate and be respectively grateful for all of his circumstances. At an early age, he was influenced by participation in federal, state, and local immigration programs that were available during the 70s. Taking the bus from inner city community to the suburbs allowed him the interaction with upper, middle class, and higher social financial classes. Furthermore, participation in college bridge programs such as Upward Bound in high school provided him with the opportunity and prepared him to be admitted into the University of California, Santa Cruz. An anesthesiologist for multiple hospitals in California, and he covered for many physicians who are on leave of absence or vacation, which allowed him the opportunity to work in different settings. He's worked at Western Medical Center in Santa Ana as an anesthesiologist, performing procedures ranging from brain surgery, labor and delivery. Advanced interventional techniques such as neuroablation, spinal peripheral nerve stimulation, PRP, and stem cell injections are used in his practice. So he is the medical director at accredited facilities such as American Pain Institute, Surgical Medical Center, National Accreditation Agency for Outpatient Surgical Centers, and personally he's been married for 24 years with 3 children, Adrienne 20, Julian 19, Serena 12. So Dr. Dominguez, an anesthesiologist, your own practice, a teacher, a mission to help people and educate your patients in the healing process. Let's begin. Welcome.
Thank you for having me. It's a pleasure to be here with you.
So tell me a little bit about yourself. How did you get started in medicine? When did this begin?
Well, as you introduced the history of my short biography there, I left some details there, but I wanted people get a feeling of my early childhood years and how I've come to my career. You know, the early developmental years, the intermediate developmental years, and then professional career. I came into medicine just by serendipity. Actually, as I mentioned, I had the opportunity to go to an undergraduate school that nurtured me, if I would say it that way, to become a physician, because the climate of students who were interested in the biological science was concentrated in one of the schools. Santa Cruz is just to give you a little preface on the university. There was like 7 colleges that comprised the university, and one of the colleges was called Oaks College, and it was a science-oriented college. And I happened to land in that college, and basically my whole life was around students who were interested in sciences, whether it was medicine or it was research in endocrinology or other sectors of the biological field. It introduced me to the area of science, and then hanging around with students who were doing well and who knew what the steps to take in order to go to the next level, whether it was to become a medical doctor or whether it was to become a research scientist and getting a PhD in those areas. It was pretty much wide open. And so excelling in science and being around that community of young scientists, it propelled me. And that's how I developed an interest in medicine. I could have gone into becoming a research scientist too. The only regret I have in my life, if there is a regret, was maybe not giving myself a chance to apply to an MD PhD program. Basically, that's the programs where it's 2 additional years of postgraduate training, but then you get 2 degrees. You get the medical degree, which is the medical science, and then you get the PhD, which is the scientific degree. It's the best of both worlds. On the other hand, I wouldn't have the practice that I have if I would have gone into that program, because most MD, PhD professionals usually work at academic centers like UCLA or UCI, or tertiary centers where they're doing top of the line research, which is so important to the development of new science to take care of people.
What was that defining factor?
So that's how I basically became a doctor. Just, I say serendipitously, because I landed in the right place at the right time, and I took advantage of those opportunities.
So what was that defining factor in medicine versus science?
That's a tough question, because I think a lot had to do with the students that I was hanging around with.
Mhm.
The majority of them, I would say 90% of them, were going into medicine, and the upperclassmen who we would socialize with, interact with, they were also applying to medical school. So I already knew the stepping stones, like what classes to take, what extracurricular activities we needed to perform, how do we prepare for the MCAT, medical admissions college test.
Mhm.
So all these little details that are so important were basically there on a plate for me. Don't get me wrong, you have to work at it, of course. Nothing's free in life, right? You have to work hard, but it was there for me, and I happened to be around that environment. And that's basically, if I were to say the reason, that was the reason. It's not because when I was a kid I wanted to become a doctor. I'll tell you a quick story. My dad, when I was 10, 12 years old, we used to go to the doctor, and my dad used to say, son, look how easy it is to be a doctor. All you need to do is get a stethoscope and put it on someone's back. And you make good money. You make good money, and it's easy. You don't have to work hard. And,
Wow.
and so I used to say, well, I mean, I was smart enough to, in my mind, say that it's not as easy as you think. Number one. And number two, I don't want to go into medicine because I want to make money. That would not be my goal anyhow. So I was very resistant to become a doctor, actually. On the contrary, I was against becoming a doctor because my dad wanted me to become a doctor. It's kind of weird, huh? Because usually you kind of want to satisfy your parents' wishes, right? I just told my son last night, son, I don't want you to become a doctor. I want you to just choose a career that you're going to be happy with, and that you're going to be the best at it and do the best at it. And I'm going to love you either way. I just want to just take that pressure out. But my dad gave me the other, that pressure that I kind of went against it.
Yeah.
Look what happened. I mean, God had a plan regardless of what I wanted to do, right? So in a nutshell, that's how I decided in the career of medicine, choosing medicine instead of going into a PhD program.
And how about the area of medicine that you're in? How did you land in pain management or anesthesiology?
That's another great story, because as you know, Christine, I know some people think that maybe that know one side of me, that maybe say, oh, you're a little ADHD, or you're super ADHD, you're not paying attention like a lot of men, right? And a lot of people may think you're not very social, but then I think I am very social, and that's where the story goes with your question. When I was in medical school, we have to choose after the first 2 years of medical school is all science. So you're learning all the basic sciences, anatomy, cadaver anatomy, you're in class. And then the third and fourth year, you do the clinical training. So that's when you start seeing patients by going in different rotations to different hospitals in different fields. And then at the end of your middle of your fourth year, you have to decide where to apply. What you got to choose pretty fast. Like, Am I going to be going to pediatrics, internal medicine, gynecology, brain surgery, orthopedics, whatever, right? There's so many fields. There's major fields, of course, general surgery, etc. And I happen to choose head and neck surgery and anesthesiology. Again, I made my life difficult because I really didn't know what I wanted to do. So it was, but I had to narrow it between two areas. And obviously it was surgery and it was anesthesiology. So my counselor in med school brought me to his office and he said, Miguel, I see that you're applying to anesthesia and surgery. Why? Why are you doing that? We need Latinos, we need Latin doctors in the community. So basically he was steering me to go away from anesthesia and surgery and to become a family practice doctor. And I told him, well, I'm sorry, I forgot what was his name, but he said, I'm sorry, but I really think that I need to follow my desires of what I want to do. And furthermore, I said, I think we need different doctors at different levels in our community, just like an army has soldiers, has generals, has super generals, different levels. I said, we need a diversity and I'm interested in this field. So there you go. There was a confrontation there of deciding, am I going to choose family practice because I'm a very social guy, or I'm going to go into surgery or anesthesia, where the anesthesiologist, as you may know, put the patient to sleep, wake them up, and never see them again. So that's how I became interested in pain management, because anesthesia, what it allows for you to do is to incorporate all the knowledge of anatomy, physiology, then the abnormalities of physiology, which is called pathophysiology of disease, pharmacology, pharmacokinetics, how the drug works in your bodies in different conditions, and just physics, chemistry. So to me, anesthesia had all these different intellectual components, and that's why I became interested in anesthesia. But I never really thought about the component of having long-term relationships with patients and having that social component to it. So when I was finishing my anesthesia residency, the fact that anesthesia provided pain relief during surgery, besides keeping the patient alive during surgery, you could extend that knowledge, right, and that experience and extend it to the area of chronic pain management. But this time you're seeing the patient forever.
There's relationship.
Relationship. So it was the best. It was like the best of both worlds, like coming together. It's like, instead of just seeing patients and not seeing them again. And hey, don't get me wrong, I love that practice where you could also just see the patient and never see them again too. I like that too, because I mean, there was a gratification and a gunshot wound coming in and then the guy going home a week later because you saved his life.
Yeah.
I mean, so there was, but I don't necessarily have to see that patient again, right?
It's incredible. Yeah.
So in chronic pain, obviously there's a relationship, and you get into the realm of, besides just prescribing a medicine or doing a procedure, there's a lot more to the relationship with patients and seeing their journey in their lives, and sharing a lot about not just their pain, but just what goes around their life. And I think that's the most gratifying part of my job.
That's incredible. So in that sense, you have a passion for educating your patients as well. How important is it for you as role of educator, being a doctor with your patients?
Well, it's very important because obviously that's my goal in my practice, is to empower patients with the knowledge that I'm acquiring also to, so they can be, so they can have the tools for them to be able to manage their pain. Because case in point, when I first got into pain management, there used to be a motto, right? The motto was, you don't have to live with the pain, right? So we're thinking, well, what are we going to do? Like put you to sleep or numb you completely, right? That's not the right motto. You don't have to live with the pain. The motto now is, yes, you have to live with the pain, but manage your pain to the level that you could function. It's about management, because I tell patients, you're not going to be pain free totally until you die. We need pain because pain signals to us when something is wrong. And so you still want to have that sensation. You don't want to be totally numbed and drugged out where if something's happening in your body, you don't know, or you can't function. So it's a very delicate balance between, making sure that we're providing a balanced approach to the patient so that they could also be empowered again with different tools, whether there could be medications, injections, or other modalities. It could be even cognitive modalities. Cognitive means mostly using your brain, it could be imagery, it could be distraction, it could be music, it could be exercise. And then you have all the other things like acupuncture too, right? And people do cupping too. I know if people are familiar with cupping.
Cupping? What's
Cupping were the Chinese medicines where they put those cups on you.
Oh, like suction.
And they suction, yeah. That's called cupping. And that, to me, all they're doing is hurting you. I mean, hurting you to distract the pain.
Move the pain from something else.
Yes, exactly.
So you just did an interview with Epic Times, the online news source, with Jackie Rios. What was that about? How was that?
Well, that came about just Jackie found out about my story, just my background and where I came from, where I grew up, and being a physician and for 30 years in the community, and me being involved in and a little bit of the politics with the Hispanic Republicans. I got that. That's how I basically came in contact with Jackie, and she asked me if she could interview me, and I said sure. So we had a good talk. Anesthesia. Well, anesthesia, it's either it's like flying an airplane. Usually, it's pretty smooth, right? Pretty smooth. But when turbulence hits, or it's raining or snowing, it get very risky. So you need to be able to know what to do in those circumstances. So for keeping pace, number one, keeping pace with the evolving technology and knowledge and science. Take as an example for COVID-19 that we're just still going through the ever-changing dynamic and the information. There's so much that we don't know, so much we do know, and it just changes so rapidly. It's hard to keep up with it. Imagine if it's hard to keep up for doctors and professionals. Imagine for the general population how difficult that may be. And the second thing is balancing that ever-changing knowledge with what we incorporate into what we call evidence-based medicine, right? What's the evidence in terms of good randomized double-blinded controlled studies that really take away the placebo and the bias to show that something is efficacious. That's what I mean by evidence-based medicine. And so taking that, again, that knowledge that's changing, and then the new evidence-based knowledge that comes to the surface, and then balancing that with insurances for them to approve those treatments for patients, even though it's evidence-based, sometimes the treatment is denied. And so that's, to me, that's the hardest part. And I would say, because, I mean, there's a saying, right? If you don't have a problem, we don't have a job, right? Patients don't come to me because there's no problem. There's a problem, right? There's uncontrolled pain, right? But there's also a problem. The secondary problem is authorizations and insurances for procedures and medications and other treatments. So that's the other facet of problems. So you combine those two, and that's about 80% of the problems and work in the practice. And of course, then there's the management, the business operations. But basically, that's, to me, that's the biggest challenge. Is that.
So that's got to be really frustrating, especially when you want to help your patients and you know what's best for them. Where does your inspiration come from?
It's come from different people throughout my life. I would say in my early years, my father, he was an educator. He's a teacher. He was very pro-education, very encouraging all the time to do well in school. Remember him telling me when we used to go to restaurants and say, if you don't go to school, you're gonna end up washing dishes back there, and that's okay if you want to do that. And so, things, he was just say things like that, that kind of stay in your mind. But again, he was an educator, so he was always pushing education. And then, in high school, which are important years, there were some teachers who were very instructive and very pivotal in terms of inspiring me, in terms of giving me confidence. But yet there were some teachers who were the opposite, right? I had one teacher that I saw in college after I had graduated from high school, and he goes, Miguel, I'm surprised you made it this far. That was not encouraging.
That's awful.
But then I said to him, I didn't learn that much from you anyhow. So no, but there's been, of course, a lot of inspiration through the years, teachers, and then in college, professors. I mean, how can I forget Grand Venerable? I mean, those were the most important years in my life when I was sharing the story of how I became a doctor, right? How I chose to become a doctor. It was because of those professors too. Mm-hmm. They were very supportive. They very patient. They were true educators. You know why? Because if you didn't understand something, because let's say you didn't pass your test, you're supposed to pass 80%, you got 50. Well, what he would do is he would go back, and the ones that you missed, you would have study sessions to understand that information. Then you take the test again. Then you pass.
Well, that's a great way to learn.
Right. So it's not about passing the test or not. It was about learning the material. You see?
Yeah.
So you can never forget that kind of teaching, right? And so that was super inspiring. It was so inspiring that when I graduated from medical school, I wrote him a letter to tell him how grateful I was for his education.
That's awesome. Mm-hmm. That's so great.
And then last but not least, I'm inspired now by my patients, because it's the patients who are the ones who have taught me so much. You remember, what is medicine? Medicine is the practice of medicine. You don't have patients, you don't have practice, right?
That's true.
Right? So not like practicing like guinea pigs or something, but you're practicing medicine, and the response of the patient and how they react and what's their perspective is, all that is teaching. It teaches you. I always had a funny saying that, you go through a career in medicine on the average 30 years, and then you gain all this knowledge and experience, and then it's time to retire. What do you do with all that knowledge? It's nice when you have a young doctor, because a young doctor comes out of practice and he has a lot of the up-to-date knowledge, but he doesn't have the clinical experience. Mm-hmm. But someone like me, who's been in it for 30 years, you have the clinical experience. And the patients are the ones that have taught you all that. So they inspire me.
What do you consider to be the greatest qualities of a doctor?
Wow. Yeah, I do have some strong opinions about that. I just made a comment to my office girl that it's hard for me to understand why a lot of physicians are not either they're agnostic or, for that matter, atheists. I could never understand it because I think being a doctor, you study so much and you see how beautiful and complex the body is. Just look at stem cells, for example, how we're using stem cells for regenerating and treating cancers. And, and just if you study how stem cells work and how, two cells make a human being. I mean, the complexities of that should give you humility, right? Should make you more humble than anything, and know that all you know is that you really don't know it in the big sense of the word, right? Of course, we know a lot, but just amazing and all. So it's hard for me to understand why there's not as many God-loving, fearing physicians, and that there is. But anyhow, I think humility is one of them that I think you need to have, and know that you don't know it all, and I know patients don't want to hear that sometimes, but there's also that dilemma. Do you tell patients the truth or you don't tell them the truth? And I think you do need to tell them the truth when you don't know. Because one time I had a patient who said, "Oh no, you can't say that, doctor, because we come to you because you're supposed to know everything," and I think you still could exert some confidence, of course, that you're going to try and keep trying to investigate or refer the patient somewhere else, or right. You always got to keep persevering and trying, which again, that's the other, I think, attribute you need to have. You need to you need to have humility, you need to persevere, right?
Yeah.
You need to adapt to the changing environment, to the change in medicine, stay up to date in medicine,
Always learning.
being open-minded. And the other thing is you have to also love people. You have to love people. Just, if you love your kids, you love your spouse, you have to have patience with them. And you have to, if you love them, you're going to have a lot of patience. And not patience, right?
You have to have patience with your patients.
Yes, yes, yes. And being willing to go out of the box sometimes.
That's interesting. Can you give me an example of that? Going out of the box for you?
Going out of the box?
Yeah.
Well, some patients will come and say, "Oh, I've taken some marijuana and I put it on my knee and it works."
Like rubbing the marijuana on your knee?
Yeah. I said, "Okay, it works. It's not causing no harm." They put it in alcohol, and it's a treatment that's been used for centuries in certain parts of the world, especially in Mexico. They tend to use that a lot, even though it's illegal. That's out of the box.
That's an interesting. Yeah, no, I've not heard of it. Well, I mean, I guess in the creams.
Mm-hmm. Yes.
All right. So
there's many other things that kind of out of the box too.
can you give me one more interesting one?
Well, if a patient comes in and says that, let's say Cialis, which is it was originally tested for hypertension, but it's for use for erectile dysfunction, is being used for other things like spasm of the leg, helping their pain. I haven't figured that one out yet, but that's kind of out of the box, right?
Yeah. That's pretty different symptoms right there.
Right, but no harm, no foul. So as a doctor, you got to understand there's a lot of placebo that goes into medicine too, and that's why you need to have these studies that kind of take away the placebo, because placebo is about 25 to 30% improvement. You could say, "Oh yeah, I took that and it helped me about 20-30%." Well, that could be placebo. That's why in studies you got to have a good bona fide relief of like at least 40-50% for a study to be effective.
That's interesting. So how do you stay current on today's advancements and the information how do you stay current on the education?
It's much easier now. In the past, you would need to just go to conferences. That would be the mainstay of staying up to date. You would go have fun, and you could still go to lecturing and socializing with your colleagues, exchange ideas. But now with the expansion of the internet and social media, there's so much platforms now where there's so much information, doctor platforms. I mean, it's too much now. I mean, it's just, you could try to become an expert in a lot of things and in a lot of areas of medicine. But I think that's what keeps me occupied besides the fun stuff. But most of the time there's just lots of information, and you got to know how to weed through it too, and which topics interest you and which topics it's worth spending the time reading on that subject. You could imagine in COVID how many studies and constantly coming out every week. And just
Yeah, how many contradicted the other?
in contradictions. Yeah, it's just incredible. It's just that only infectious disease physicians are stuck on the computer just reading all this information and staying up to date if they're going to become experts on that subject. So basically that reference the books are mostly used as references. Anatomy doesn't change, right?
Yeah.
A lot of pathophysiology doesn't change either, but treatments do. Advances in treatments for disease. I mean, stem cells was not even around when I was in training.
Okay. So what is the most important piece of advice you'd give somebody who wants to go into the medical field?
Well, first and foremost, it is a long career, and that's why there's a lot of pushback, right? Because it's a long career. It's 12 plus years, and it's true. I was just looking at a graph not too long ago on get one of those platforms for physicians and seeing how long it takes to become a doctor. And there's only a few countries where it takes as long as in the United States. 80% of the other countries is 2 years less. So you do undergrad in med school like in 6 years, and then you do your clinical training.
Wow.
So it shortens it like by 2 years. Where here it's like undergrad 4 years, and then medical school 4 years, and then your clinical training. And in other countries like Mexico, for example, and many other European countries, it's 6 years for undergrad and medical training. So it cuts down by 2 years. But it's a long career. So first of all and foremost, it's a lot of dedication, of course, commitment. It's very competitive, I understand. There's a lot of controversy right now too about we're not producing enough physicians because it costs a lot of money to produce a doctor, and they only have limited amount of seats per school. So the government will need to come in and spend more money into these schools so they can either double the size of the classes. The other problem is having enough residencies to fill the vacancies for the training after. That's another issue. But yeah, so dedication, it's a long career. Be willing to take on a debt, financial debt, because it'll cost a lot of money to go to med school. And I would say the most important thing for someone to decide to go into medicine is you need to go into it because you really love the science and you love the gratification of taking care of people. If you go in it for the money, I think you're going to be extremely disappointed because things are very different now. Out of the whole expenditure in healthcare, I think it was like 3 or 5% is through physician reimbursement.
Yeah, do what you enjoy and you'll never work a day in your life.
Yeah, with respect to finances, I always advise young students that don't worry about, your debt too much because you have the rest of your life to pay for it. And if you die, you don't have to pay it back.
That's only something a doctor would say with like the smile on your face. That's so great. So tell people where they can find you in your practices.
Where? Well, now you can find me anywhere. You just Google me, right?
What's the name of your website?
Oh, it's American Pain, all one word. American Pain, PAIN.US.
And what are the last few things you'd like to share with everyone? Maybe something personal, something about the practice, anything you can think of.
A few things. One is, I always tell patients who, when they feel down and out, and sometimes I don't want to live anymore like this. I'm in too much pain. I always tell them, better a live dog than a dead lion. Because a dog has hope, but the lion is dead. And even if you're feeling really, really, really bad, and you feel worthless, or you feel like you're not useful anymore for whatever reason, you have hope, and there is hope that you're going to get better. Things are going to change. But if you die, that's why I'm against suicide, right? If you die, there's no hope anymore. So that's I was thinking about the things that I say the most to people, and that's kind of my favorite quote. I know it sounds kind of weird, but if you get the gist of the quote, it makes sense. You didn't ask me what kind of music I like.
I didn't. Tell me, what kind of music do you like?
Well, in the office, I've always been pretty diverse, so we play all kinds of music depending on the mood, but ranging from the 70s to the 80s to the 90s, some old pop, and sometimes we play some classical and some jazz.
What's your favorite music?
Old school R&B.
Okay, I love it. Yeah, I have to agree with you there. That's pretty good. And your office, tell me, because I know, but you tell everyone, what do your patients think about you guys over at American Pain?
I don't know.
They don't think of you as family? I think they think of you guys as family.
They do?
Sending you cards and cakes and food and
Yeah, that's what makes the world go round, right? That's why through the pandemic we were open. We never really closed. We were here, and it was therapeutic for us as well as the patients who wanted to come in. The technology was not as good as we have right now, but it was pretty sketchy. And the problem with technology too is that you have a lot of older people who cannot they don't know how to use technology, so it makes it very difficult. So then you have to just talk on the phone, and it's not the same. You can't examine the patient through the phone.
yeah, the telehealth is a little difficult.
Imagine going to your OBGYN through the phone.
I don't know how that would work, but that's pretty funny.
No, we were just talking about that with another patient the other day. That's why it came to my mind.
Yeah, that's a pretty good analogy.
The recent things come up, just the recent things, discussions come up.
Well, any last things you'd like to add?
No, just want to thank you for this opportunity to have a good chat and spread the information and different perspectives, and hopefully we can inspire some people.
Thank you so much. I know you're going to inspire more people to come visit your website and watch the Epic Times, because you do a lot of education and training. And thank you. Thank you for joining us today.
Thank you for all you do also for the community, Christine.
Thank you. Well, I will talk to you soon. Have a great rest of your day.
Thank you. Bye.